And now a message from Dr. Baxter, obstetrician and gynecologist at Nanticoke Women's Health Services.
A PAP smear is a specific test used for cervical cancer screening, where cells are collected from the cervix with a brush or spatula and sent to the lab for review. The specimen may also be tested for HPV or human papillomavirus. It is important to remember that if your provider performs a pelvic exam, a PAP smear is not always collected unless you are due for this testing. I would like to review the current guidelines for screening, which have been updated in 2012. The goal is to detect precancerous changes before they progress to cervical cancer. PAP smears are to begin at age 21, regardless of what age sexual activity was initiated. Now, prior to age 21, women who are sexually active should be screened for sexually transmitted infections, and they may also be seen by their women's health providers for contraception or other women's health concerns. Women ages 21 to 29 should have a PAP smear every 3 years. Then from ages 30 to 64, HPV testing is added to the PAP smear, and this can be repeated every 5 years if both the HPV test and the cells from the cervix are negative. It is also acceptable to continue PAP smears without the HPV testing every 3 years. So at what age can cervical cancer screening stop? From age 65, it is not necessary to continue PAP smears if the last 2 PAPs and HPV tests are negative, and of course there's no history of moderate or severe precancerous changes or actual cancer. Now, what if you've had a hysterectomy? If the cervix was removed with the hysterectomy and no history of moderate to severe precancerous changes or other gynecologic cancers, PAP smears can be discontinued. Now, it is important to remember to continue regular visits to your provider for routine health maintenance as well as yearly breast and pelvic exams.